Now, when it comes to facial rejuvenation, hopefully you've been thinking about this long enough that you've been taking good care of your skin early on in life. That includes using sunscreens and some antioxidants and controlling acne, because that damage starts when we're young and can continue. And I will tell you that it's much better to prevent wrinkles than to try to get rid of them later. As early as our 30s, we start losing a lot of volume in our faces, and that is our skin getting thinner, fat pads getting smaller and descending, and some other fat pads getting a little bit bigger. And it's really surprising the changes that happen at the level of the bone. If you put on your CSI hat for a second, you can guess the age of someone if you get some of their skull, and that's because it changes a lot with age. Again, starting in our 30s, our orbit, which is the bone socket that holds our eyeball, gets bigger. So you start seeing more hollowness around here and some fat pads that may be coming forward. This bone, your maxilla, drops back. This bone resorbs here and your cheekbone becomes less pronounced. And along your lower jaw, and this is especially true in women, this really starts to lose volume. So you see the corner of the jaw out here going from sort of a right angle to more of a straight line. And if you wonder what jowls are and how those happen, is as this bone is getting smaller, there are these ligaments that hold the skin to your bone here, and with that loss of volume out here, those areas go up, which exacerbates the look of your jowl falling down. So those are all very typical things that happen as people age. You've got sun damage, pollutants, and motion that help age your skin. You've got volume loss, and the combination of both of those develop laxity. And laxity is really where we're looking at more of a surgical correction. So when I see a patient, the first thing I want to do is make sure your skin is looking as good as it can possibly look. Just having what we call hyperpigmentation or brown spots on your skin can age you tremendously. When people, like average people, are shown pictures of people with hyperpigmentation and then corrected, they actually guess their age to be 5 to 7 years younger. We like to use retin-A products because that helps to get the sort of the dry, dead skin off the surface, which isn't very pretty. I like to use the analogy of tree bark. When we're young, our skin is more like an aspen tree. You can rub your hands up and down that bark and it's very smooth. When we get older, it's a little bit more like maybe a pine tree where there's barnacles and bumpiness, and that's what the retin-A is going to flake off. That's why people are peeling so much when they get started. But really where the money is with that is what's happening deeper in your dermis, which is the deeper layer of your skin, what I call your pretty layer of skin, or the spanx of your skin. That gets a lot thinner as we age, while the outer layer of skin gets a lot thicker as we age. And what the retinoid products do is it thins the outer layer that's not so pretty and can more than double that deep layer so that you have healthier, less inflamed, and better looking skin. It's shocking how many patients come in that say, oh yeah, my dermatologist gave that to me, or I have some, but I don't really use it. That is truly one of the fountains of youth. So getting started on retin-A products is wonderful. We don't recommend people who are planning on getting pregnant, who are pregnant, or who are breastfeeding to be on that product. And it does require a prescription. If you're getting something just like off the internet or like at Target, there is a very low percentage of the active ingredient. So if you're serious about this, it's good to get something that's prescription strength. We also have skincare products that can control that pigment, whether it's reds or browns in the skin. And the next step past skincare is actually to maybe use devices like peels, which can be done in the office, light treatments, which can help correct color, and even lasers or something called Elicor, which really is great at deeper wrinkles around this area of your face to help improve your overall skin. We all know about dermal fillers or injectables. Those are very, very popular. And what those can do is add some volume that gives you more of a youthful shape to your face, or even some volume that helps decrease areas of depression to make things look more full. So popular areas may be temples that deflate with age, cheekbones that become a little bit flatter with age, deeper lines here, here, and even a little bit more chin projection can make you look youthful. Adding some volume in this area here can be really helpful at camouflaging the jowl. So that's another step that you can do short of surgery to get things looking better. Now, when it comes to surgery, that may be somebody that's young in their 40s, or it may be somebody that's a lot more mature. I joke that I wish I were a pediatric facelift surgeon and all my patients were in their 40s and 50s, because they are the real easy ones. Maybe emotionally it's hard to go through that surgery, but the look is usually pretty fantastic. As you get older and the aging is a little bit worse, whether it's your skin quality, volume loss, or elasticity to your skin, we're going to see less dramatic results, but it doesn't mean it's it's a reason not to do it. It's just you have to understand that you may be starting with some natural resources and some tissue characteristics that aren't as ideal. Also, people think if you're going to do just a surgery, it's one and done and you never have to do anything else. And I think that's kind of pretty off the mark, because that's making a big investment and upkeep is important. So it's kind of like you get your whole yard landscaped. You're still going to need to mow, weed, water, and every once in a while put in some new flowers. So we love people coming in and getting started on skincare if that's where they are at this point. We can also teach you about things like neuromodulators that are like Botox or Daxify to soften animation lines, and then more aggressive skin treatments to help combat those wrinkles, because you didn't get them overnight and they usually don't go away overnight. It's more of an ongoing series of getting the best result possible for your skin. And when you're ready for surgery, I've got you covered. I like to do all of those things at once if it's needed. We like to use fat transfer for volume. We like to do things like maybe raise your brows, take out some of that extra skin or fat around your eyes, add volume with fat transfer in multiple areas of your face. Now, fat transfer is great because it comes from you. Regardless of your age, it does have stem cells in it, which can have great rejuvenative properties. And you're not paying by the syringe, which makes it a little bit more cost effective. About 20% of the fat we put in is considered more of a permanent take. But the downside is you do continue to age, so you probably will need more volume as time goes by. Then we can also do things like face and neck lifts, which are really powerful. That involves an incision around the ear and under the chin. We like to tighten the neck muscles called the platysma, remove fat that we don't like along in here, and maybe add some fat in some areas to give you a more pronounced jawline. We do some lifting over here in the cheek and then pull the neck back more tightly, but in the face, tight is kind of a no-no. We like to more gently take that skin out so that you don't get a pulled or an artificial look afterwards. So wherever you are in your journey, I don't think you're too young to start taking care of your skin. And I'll let you know if I feel like maybe you sort of missed your prime on doing a procedure to get you looking better, but hopefully we have something here for everyone.